Marot, PCO Chief Editor, and we have here Camilo Helito, a well-renowned surgeon in sports surgery from Brazil. It's great to have you here, Camilo.
Big pleasure to be here in Toulouse with you. Thank you very much for the invitation.
So let's go straight to the important things. We had a great cadaveric lab together. We talked about rectus femoris. I think it's now a hot topic. It's a great graft. What do you think about it? I know you have a great experience on it. I've done a few myself, and I would like to know what are your feelings about patients' recovery, usefulness during surgery.
We always talk a lot about grafts for ACL and ligament reconstructions around the knee. And of course, we have like the most well-known grafts as hamstrings, BTB, quad tendon. However, if you are doing a lot of revision surgeries, if you have like a lot of multi-ligament knee reconstructions, and you don't have like a lot of allograft available, sometimes you need to think about other options. That's why a few years ago we started to use more and more the peroneus, and maybe 2 years ago we started to use the rectus femoris. I think rectus femoris is a wonderful option. It's incredible when you harvest it for the first time. You see like incredible graft. It's very impressive, and I think it has enough length for you to do like multiple graft configurations. You can do like a 2-strand, 3-strand ACL plus anterolateral reconstruction, ACL plus medial reinforcement. So there's a lot of possibilities you can use. And also the recovery is pretty surprising as well. Most of the cases, the vast majority do really well with no quadriceps inhibition and no big problems when you harvest it. So I think it's an incredible option that it's growing a lot all over the world. I'm very glad my friends from France and Doha are using a lot, and I'm sure in the near future more and more people will be using it.
Yeah. What do you think about post-operative pain? I have the feeling that they are even less painful than after taking the hamstrings. What do you think about that?
I do agree. Patients they don't have like much pain, and also they don't have much quadriceps inhibition. It's very rarely to have an hematoma. Rarely patients can have it. So overall, I think the initial recovery is pretty good.
Okay, great. Do you have any other technique that influence your work this year? When I know you go to many congresses. Did you learn anything that changed your way to work this year? Do you have anything to?
I think our field is always going forward. This is very interesting. If you stay like 2 years and if you don't go to any conference, you will lose a lot. Especially this conference here, I think it's very practical. So I think we are always evolving a lot. I mean, we passed some phases. I think there was a very strong discussion regarding the anterolateral part of the knee a few years ago. Now we are returning for new grafts and discussing more and more about the medial side as well. So I think things, they just come and go. And we just need to be aware that what we do, we can always improve what we do. And we have to be aware of that, because in the end, the idea is to improve the results of our patients.
Okay, great. What about AI? Do you use AI routinely for your researchers or anything? Or do you think AI is going to influence our way to work, our way to operate on patients?
I'm sure it will. I think we are more and more close to that. So far, we are using a lot of AI for research. So we just published one study with machine learning, checking for the risk factors for ACL failure. We have an ongoing study for meniscus repair as well. And, but you know, AI will be present in every field, and certainly for surgery, it will help us a lot, I hope, in the near future.
Okay. Last question, do you have any advice for young surgeons that in this Congress we're going to have a lot of young surgeons coming here? Do you have any advice to give them?
I mean, try to learn as much as you can. I think congresses overall nowadays, and especially this one, are very practical. So you have to, you know, follow the leaders in your field, try to learn as much as you can, study a lot, do research, and try to go abroad to see different things to change your mind. So I think these are like good advices for you to improve your career.
Great. Thank you very much, Camilo.
Thank you for the opportunity.
Merci.
Thank you.